So welcome to our September 24th Board of Directors meeting. This is our annual meeting for the year. So we'll call the meeting to order. It's 6:04 now. We do have a new labor rep that's going to be joining us, and I'll have Jimmy introduce Nancy later on. I don't believe that we have any of the new members representatives on the Zoom.
I haven't seen any
that we can see of. So if so, let us know. So we do have quorum, so we will move into approval of the August 27th minutes. Is there somebody who would like to move them?
Moved, Terry Baxter.
Thank you, Terry. And a second?
Second, Gary Muchler.
Thank you, Gary. Okay, were there any changes to the minutes that needed to happen? Okay, hearing none, we'll call for a vote. All those in favor of approval of the August 27th minutes, please say aye.
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 Okay, for changes to the agenda, we are going to be adding to, under new business, a motion to approve the 2021 MCA. After we've accepted all of our new members, we will create our 2021 Municipal Cooperative Agreement. So we'll add that at the end. There's going to be a discussion regarding extension of benefits that Elon's going to talk about with Excelis. We'll add a motion in there. Once we get there, I will start that motion. And then we're going to reorder under number 10. We're going to switch A and B. So we will address the premium holiday before we address the 21 budget. So those are all the changes I have. Elon, do you have anything else?
No, you covered them.
So for our chair's report, we do have, we had a vacancy on our audit and finance committee, and we will be appointing Jason Molino from Tompkins County to that committee, and he will be filling out a current term which will end 12/31/21. So somebody like to make the motion to appoint Jason Molino to the audit and finance committee?
I'll move that, Peter Salton.
Thank you, Peter. Is there a second?
I'll second Lisa Holmes.
Thank you, Lisa. Any discussion? Okay. So approval of appointing Jason Molino to the Audit and Finance Committee with a term ending 12/31/2020. Say aye.
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 Okay. And in your packet, there is a draft resolution creating our nominations committee. It is this committee that will work on our 2021 consortium leadership. This is one of the committees that's in our bylaws, our new bylaws to be created. But this year they're going to be working on the slate of officers and the slate of directors and the new executive committee for 2021. So I do, we've talked to a few people, but we'd like to get 5 people on that nominating committee. Ed Fairbrother, are you still willing to serve on that?
Oh, he's probably on. I think everyone got.
Yes, I will.
Okay, thank you, Ed. Laura Shawley,
She on?
are you on? Laura's served on it for a few years now. I don't see Laura. All right, I don't see Laura at this time, but she had volunteered to stay on it for another year. And so we are looking for 3 others that would be willing to serve on this nominating committee. So it would be really great if we could get 3 more who would be willing to do that. You can unmute now. This is when you unmute and say, okay, I'll do it. And Don Barber's going to be working with this group to help
Launch them.
launch our new slate of officers. So who else?
Judy, this is Terry Baxter. Don had sent me an email. I didn't get back to him, but I will participate.
Thank you, Terry. Can we get 2 more by any chance? Kevin Williams, I think you were thinking about it.
I don't think so.
Don was thinking about it for me, yes. And I've actually in communication with him right now. I haven't resolved anything. I'm trying to find some workarounds here, but I will get back to you one way or the other.
Okay. Anybody else who might be interested? Any of our labor reps interested at all? Fill one more spot. Okay.
I'd be willing to serve, Gary Muchler.
We'll try to fill in those other 2 slots as we go. This is just at this point a very short-term committee that works on the slate for next year.
Judy, you might not have heard him, but Gary Muchler said he would
Oh, Gary,
serve.
great,
We did not hear, huh?
excellent. I did not hear Gary, so and possibly Kevin. Great, thank you for volunteering. So we'll call for a vote of the creation of the nominating committee for the 2021 Consortium leadership. We have Ed Fairbrothers, Laura Shawley, Terry Baxter, Gary Mulchler, and maybe Kevin Williams. All those in favor say aye.
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 Hold on, I have to have somebody move it first. Would somebody move that motion?
I'll move it. Oh,
Thank you, Steve.
Yep.
Is there a second?
I'll second.
Who's that?
I think that was Charmaine.
Charmaine?
Yes.
Okay.
Charmaine, take it, Charmaine.
Okay, so we'll do a vote one more time. All those in favor say aye.
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 All right, getting ahead of myself. Thank you. Okay, so the other thing you will see that's in your packet is the bylaws for the executive committee. Now that the 2020 Municipal Cooperative Agreement has been approved, we're going to be moving towards adopting the bylaws. This is something that the board of directors will be taking up in December. And then we will start operating under the new bylaws starting January 1st with our new executive committee. I'm hoping that people got a little bit of a chance to look at the bylaws. Our executive committee is going to be talking about them in October to make sure that they're good to go. Were there any questions, comments, or anything anybody wants to bring up at this time?
Yeah, just I would suggest that people really should take a look at those. They will be the document that essentially sets forth how we run this consortium on a day-to-day basis, with the exception of our annual meeting when all the important votes take place.
Thank you, Peter.
Okay, this is Eric Snow, and I have a question on it. It includes the Owning Your Own Health Committee as a representative in there. There are 2 places in there it refers to that, and I thought we had abandoned that committee.
We've put that committee on pause for 2021 at this point, and we've folded it into the joint committee for right now. But we do have the opportunity to bring it back if there's a need to do that.
But this is saying that you get a member on the board of, from that committee. But at this point for this year, you wouldn't have, right?
Right. So what we did, if you looked at the nominating committee resolution, we're starting off with looking at 11 members of the executive committee. And at this point, we have left off the Own Your Own Health chair because there won't be one.
Okay.
So that gets us the rest of our committees, the Audit and Finance, Operations, Nominations and Engagement, Claims and Appeals, and then 2 at-large members. So at this point where we won't be filling the Own Your Own Health chair for the Executive Committee. So that's why we're at 11.
Okay.
Okay. Any other questions? Okay. If you have any, please send them on to Elin or myself. We certainly, the Executive Committee would like to have any comments before we start our discussion the second week of October. Okay. So moving on for report from the Executive Committee. Some of the things that we will be working on in in our October meeting is our PROACT contract. That is up at the end of the year. So we'll be talking about our PROACT renewal and our prescription benefit management RFP. So that process we'll be talking about. We're also going to be talking about staffing and staffing needs and filling some positions. We're going to be talking about the Department of Financial Services request for us to be able to get our certificate of authority. There's still some pieces that we need to provide on premium equivalent rates and some plan documents. And then, of course, we're going to be talking about our bylaws. So those are some, it's going to be a busy meeting, Executive Committee, as we move forward. So those are some things that we're talking about there. Any questions? Okay. I will turn it over to Elin for our Executive Director's report.
Okay, great. Thank you, Judy. Good evening, everyone. It's great to see most of you again. I have provided a written report. I'm not going through all the details of what has been put in writing. Feel free to ask any questions if you have looked that over. I do want to highlight a few things that are either in the report or will be coming up in the meeting. As you know, at this meeting, we're going to be looking at the budget and approving the budget for 2021. There's a lot of people who've been working on that for the last couple months. And we hope we get over the finish line this evening. There are a few things that will be presented as a part of that, and I just want to answer maybe some questions in advance. If the premium holiday is approved, we will be sending out communication about what the invoices are going to look like, what it means logistically to have a premium holiday. We're talking about coverage for the month of December, what your invoice is going to look like when you'll receive that, and other information along with that. So Judy and I have been working with the finance, I just totally lost my train of thought.
Finance office.
At the finance office, thank you, Judy, for the how that's all going to come to play. So we won't address all of that this evening, but please know we'll follow up should we approve a premium holiday. The other is the premium equivalent rates are in your package, and they are we are continuing to work on just updating them every day, making sure that the plans that have been eliminated, that those of you who have changed plans this year or plan on changing plans next year, that we post those rates for you. So as soon as we make sure those changes have all been made, and we're in the process of doing that, working with Excelis, and Rob and others, we will post that on the website, and we'll let you all know that those are final. But when we pass the budget this evening, we will pass it with a %. Right now it's recommended 5%. So you can assume That's how your premium is going to increase next year. But we will get all the specifics. The metal level plans have changed a little bit due to activity brought forward to the board to approve some plan changes. But as you know, we price our metal level plans a little bit differently. So Mac will address that later in the meeting. And I just want you to know, when we feel everything's been added and deleted, we will post it on the website. Some of your benefit clerks have been asking for that already, and we'll get it out as soon as we can. Speaking of benefit clerks, we are going to be hosting benefit clerk meetings this year in October. We're going to have 3 meetings. A save the date with an invitation is going to be coming out very soon. We will copy all directors, but the invitation is going to go to your benefit clerks to ask them to attend, and we're calling it a mandatory meeting. Last year we called it training, and a lot of benefit clerks said, I already know what I'm doing, I don't need to attend. But this is where we discuss the plan changes, we discuss government updates, we discuss any changes with Excelis and ProAct and administration, and talk about other common items and issues that have come up over the last year. So we strongly encourage our members to participate. Those dates are going to be October 15th for those of you that input directly with Excelis. Those are some of our larger members who do their own data processing through Excelis. And then on October 19th, we will be doing smaller municipalities that don't input directly. And then on the 20th, we'll be doing new members. So save the dates will be coming out, invitations will be coming out on that. And please encourage your benefit clerks to attend. The other thing that will be coming out very soon are 2 copies of the MCA. It will come out with a cover letter explaining the actions that we need you to take. And so I'll remind you again why there are going to be 2. One is the recently approved 2020 amended MCA and the whole process we went through on that. The cover letter highlights the changes that were made. And then the second one, part of our feedback from DFS is every time we make an amendment and new members are considered amendments, we need to send it out to everybody and get another signature. So the signatures are going to be requested as soon as all of our new members have been approved. We'll discuss why one of them is going to be pending a little bit later. But once they're all approved, we will get those MCAs out to you for your signatures 2 times, and we'll be instructing how to send that to us. So the next thing I'd like to say is thank you to Don Barber. We have 8 new member applications in front of you this evening, and that is something that Don has stayed on to work with and go through the application process. And it's quite cumbersome. It was very time consuming this year. And so bringing that all to an end right now, I show my appreciation to Don, the rest of the team, Michelle and Deborah, and I were working weekly to make sure we had all the documents, and Rick and Steve for their financial review. So thank you to everyone who participated in that process. Don is also still working on the newsletter. If you haven't received it electronically, you will receive it in paper form if that's your request soon. So be on the lookout for that. One of the things that's covered in the newsletter is the flu shot clinics. We are having, I can't imagine why, but we are having incredible signups and participation for flu clinics. We've extended dates and times. We just added 2 more clinics today. So please stay tuned on the website. You may attend another location if your location is sold out. For example, if you're in Ithaca, there will be posted city, town, and county. I think you can also swing up to Trumansburg. So there are other locations. Please make sure you look for those locations if you'd like to get a flu shot through the consortium. And then the last thing I have, which was not on the agenda because Excelis just requested this of us recently, is, as you know, we went above and beyond some of the government mandates, and during the New York State of Emergency in our June meeting, we approved coverage for COVID, for treatment of COVID, for all the co-pays and co-insurance. Excelis has asked us to join them again to provide access to coverage with no barriers for those who have been diagnosed with COVID, because right now there are no state mandates that we cover treatment. There are mandates that cover testing and diagnosis. So we have been asked to join Excelis in extending the coverage, which would have ended September 7th, through the end of the state of emergency. So we don't have to keep revisiting this. I've talked to Steve about the risk that we feel we might endure by participating in this. And it's really minimal risk because we'd already be paying for the treatment of the responsibility normally covered under our insurance. What we are adding is the addition of the co-pays that the employees would be paying out of their pocket. So it's really 100% coverage to the employee. As you know, we already cover some of that. So it would be minimal risk. The other item that Steve brought up that we do want to consider and have part of the conversation is this is adding a benefit. It's a negotiated benefit. Some of you may not want to add a benefit that's not negotiated, but this is for a very limited period of time, hopefully, during the state of emergency, and it's only for those co-pays and those co-insurance during the time of COVID. So with that said, I will turn it over to Judy to present a motion, and then we can discuss any questions.
Okay. Thank you, Elin. So I will make the motion, extension of expanded coverage to allow paid in full benefits for any COVID-related treatment through the New York State state of emergency. Is there somebody who would second that?
I'll second.
Sorry.
And we'll take Mark. Thank you, Mark.
You're
Any comments, concerns, discussion?
I have a simple question. If on college campuses and probably other places as well, obviously I'm referring to specifically the college, we have to do periodic testing based on state mandates. The question came up in another meeting is if tests are not medically necessary or medically driven, but yet a requirement, does our insurance pay for that test, or does it have to be medically requested?
So I've learned very recently I should not quote benefits without that in front of me. So I'm going to turn your question over to Beth Miller, who I know will answer it for us. And Beth and I also have that in writing, and we can send that out, the specific regulation out after the meeting, but Beth will address that at this time.
Hi, Sunday. Yes, it's a very frequently asked question because there is a lot of pressure to have people tested, and it is not covered unless you are showing signs and symptoms or requested by your physician. And if you refer to our website, there's a specific call out regarding that. It would not be covered based on pandemic control.
Okay, thank you.
Yep. Thank you to Judy. Judy has already called it to my attention that it is in writing in my executive director report. So that was actually a quiz that Sunday was planted in the audience to see how many of you have actually read the executive director report. So Judy passes because I did write it there. I wrote that so long ago, I did not recall that. So feel free to see the actual wording on that in that report. There's another item that was asked in the chat group if we were going to discuss any follow-up regarding any of our groups that have late payment, because that did come up at a previous board meeting. That is also addressed under the Audit and Finance Committee, that is a complex situation that will be discussed at the executive committee. So there isn't a report other than in the executive director report, and we ask that that be tabled until our next meeting.
Okay, so we'll go back to the resolution. We have a move and a second to pass this extension on. Any other comments?
Yeah, Judy, this is Terry Baxter. When does the extension expire?
So we have it expiring when the New York state of emergency expires, so that we don't have to keep coming back and extending it. I think everybody's hoping that state of emergency will end soon. And I believe that's what Excelis has done at this point too. So we're kind of walking the same line as Excelis.
Okay, thank you.
So, yeah, I want to pipe in on this issue of testing and pandemic control. I understand Excelis's position. Is it possible that the organizations that are undertaking these pandemic controls, Beth, are actually covering some of that themselves? Have you heard anything like that?
I believe some are contracting directly with like Hugo Medical Center for the testing.
Yeah, Beth is muted.
Yeah, sorry, I just got unmuted. You are correct, Judy. Some districts have actually gone and secured testing availability for their employees. Others have actually utilized the county's free state-driven testing sites also. So there is a variety going on, and then I think some of our districts have actually pulled away and not made it mandatory. They'd like it to happen, but not enforcing it. So it's kind of a gamut.
Okay. Yeah. No, I mean, I think if you're going to control the pandemic, you got to do what you have to do. And, you know, perhaps some of the, you know, the insurers need to step up to the plate if they can. That's the feedback I'm giving you right now.
One other question. Do we have a lot of, if any, high deductible plans, and will that be covered in this motion?
That is,
We do have some high deductible.
yeah, we do have high deductible plans that in the original motion, and Beth and Steve helped me out here, it was the testing waives the high deductibility, but the coverage is not waived.
So with the high deductible health plans, yes, if you go in for the initial, if you have symptoms, you go for initial testing and treatment, initial visits, the copays are all waived on that, and so is the deductible currently. So they did change some of the rules with regards to health savings accounts to make that acceptable and make sure that that didn't fly in the face of those high deductible health plans and the health savings account rules. Now, in terms of the treatment beyond that, so if someone did end up as an inpatient in the hospital and we waive copay, I'll have to take a look and see what the impact would be on the individual side for use of their health savings account money to pay for that if it was not going to be covered. Now that it is covered, I want to just double check to make sure that we're not violating the rules of the high deductible health plan in doing it. We only have a handful of people currently in the high deductible health plans in comparison to the total population. So from a plan perspective, it's not much of a risk or liability. And Beth, I don't know if you've gotten feedback from your folks on this question, but the question would be, the IRS has given relief to those people who have a high deductible health plan for the waiving of the copays and deductibles for the initial testing and treatment. I don't know that they've done that for any additional benefits beyond that. And I don't know if you've heard that or not.
No, I have not. And Steve, I'm jotting that down as a takeaway. So let me work on that, and I'll circle back with you and Elin.
If that is a complication for the high deductible health plans, we run them into a problem with the IRS. Obviously, we wouldn't apply the benefit to those groups. We wouldn't be able to. Legally, we couldn't. We wouldn't want to expose them to any type of tax penalty or anything along those lines. So if that were the case, if later found out that it's not allowed because of the IRS rules, we would not apply this particular benefit to the silver, the gold, the silver, or the bronze plans. For every other plan, it could be applied. There would be no IRS consequence, no health insurance consequence. And then in terms of the risk to the consortium, as has been stated, it's fairly minimal because we are only talking about the patient's out-of-pocket expense, not the entire expense of the stay. That is already going to be covered, sans the deductibles or copays.
Other questions? Okay, hearing none, we'll call for a vote of extension of the expanded coverage to allow paid in full benefits for any COVID-related treatment through the extension of the New York state of emergency. All those in favor say aye.
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 Nays? Abstentions? Okay, thank you. Elin, anything else from the executive director's report?
No, I think that's everything unless there's any other questions on any of the other items. Okay, hearing none, this concludes my report.
Thank you, Elin. So we'll do a report of the operations committee. Lisa Holmes.
Yes, a very brief report from me. We have not met, the operations committee has not met since our last board meeting. We plan to meet on Monday, the 28th. So that's it for me.
Okay, thank you. So we will move on to the financial report, starting off with our financial report from Steve Losey.
Thank you, Judy. So this year what we did is we put our presentation together for the budget basically in two separate categories of really, or two basic presentations. So the first part of the budget report is really an update on our financial position year to date for 2020. And then somewhere, I think it's the fifth section in, we actually get into our fiscal year projections for 2021. So I'm just going to give you a quick update, go through the first few slides of the presentation on this year's results. We'll open it up for Rick to speak from his perspective, from the treasurer's perspective, and anything he sees going on. And then what we'll do is we'll come back, and myself and Elin will walk you through the rest of the budget presentation, going through all the different elements of the budget, and then coming ultimately to a recommendation on that budget. So with that being said, if we could put up the budget presentation.
You don't have it?
Steve, can you share its screen or no?
Maybe. Give me a second, I'll have to call it up. I apologize. I thought it, you folks already had it.
If you have the other document up, can't you? Do you have your?
We'll get there. Hang on, I'm sorry.
What?
Sorry, Steve, I had the other spreadsheet, but I don't have the.
Sorry, no, it's all right. I'll have it here in 2 seconds. I apologize. Of course, it's on my laptop and not on my main computer. So hang on. It's gonna take me just a second to do this. Okay, let's see. Everybody see that now? Yes?
Yep.
Oh, good. Okay. All right. So we've got the budget presentation. Sorry about that. So the first slide we're going to take a look at is slide 3, which just goes through the income year to date. And we went through a lot of this information at the last meeting last month. But you can see that our premium income is pretty much right on budget. We're 0.27% above budget on that through the first 8 months. We did have an increase in our overall covered lives count and contract count, about 3% on contracts, about 2% on covered lives. We have had some movement in plan design. Some folks have moved from traditional indemnity or PPO plans into the Consortium's Platinum PPO plan. So those have kind of counterbalanced each other, bringing us kind of pretty close to the budget year to date in terms of premium. Our interest income is down a bit. That's going to be a trend you're going to see over the next year. We were doing great on interest until the COVID-19 pandemic hit, and all of a sudden it took a turn south, and we're going to have pretty modest interest income to report over the next several months and probably the next year or two. In terms of prescription drug rebate, pharmaceutical rebates, we're above budget on that end, and overall we're about $380,000 over budget on premium income, which obviously is good news from that perspective. Going forward to the next slide, just a couple notes, mainly what I just covered for you folks. Talk a little bit about the stop loss insurance. In fact, we've only had about $29,000 in recovery there. And then just other income is really negligible year to date. From an expense perspective, a little hard to see here. but if you have the electronic version, you can certainly take a look at it. Our medical claims are currently about 16.72% below budget year to date. So about 4 million, almost 4.15 million below budget year to date. And that's one of the reasons why in this discussion we're going to have about budget, we are talking about some premium holiday for this year, basically because of the fact that we've gained quite a bit of net income as a result of the pandemic that we did not obviously anticipate. And as a result of that, I think it's the executive committee's, the audit and finance committee's opinion that we could return those funds back through a premium holiday, and it really wouldn't do anything negative to the group as a whole. On top of that, we did have prescription drug rebates come in a little bit over budget, 2.7%. The rest of the expenses are all fairly small and nominal in terms of their impact on the overall budget. And you can certainly see down at the bottom of the page, overall our expenses are about 4.46%, I'm sorry, $4.46 million below budget year to date. In terms of some other comments, I just mentioned about the COVID-19, medical claims being down. Here's the budget versus actual on the medical claims and prescription drug claims collectively, and you can certainly see the difference there. On a percentage basis in terms of where the money is going, you know, obviously this is something we always point to in terms of efficiency. And currently we're still spending about 94 cents on the dollar going out to pay the benefits of the members, which only leaves about 6 cents on the dollar to pay for everything else. And that includes our stop loss insurance, which is over 0.5%, taxes and fees, which are about 0.66%, professional services at a little over 0.5%, insurances, internal fees, less than 1%, and then admin fees for Excellus and ProAct down around 3.3%, which is extremely modest. Just an exhibit showing the increase in covered lives and contracts that we've had over the years, just kind of highlighting some of that information. And then in terms of paid claims, again, just highlighting the fact that we're so far below budget on medical and pretty close to budget on drug. And then collectively, we're 11.4% below budget through the first 8 months of this fiscal year. And then here's the graph that shows month by month where we've been. We did have a little bit of a spike up in July. Couple reasons for that. We did have some increase in large loss use in that time period. And we also did have 5 weekly payments in that particular month. And whenever we have that, we do anticipate being a little bit over budget. So that wasn't out of norm. And we dropped right back off in August. So you can certainly see that we're back below budget here. This just shows month by month for the fiscal years where the claims have been. The red line is this year to date. And you can certainly see the impact of the pandemic as we went through March, April, May, June, and then July spiked up and August came right back down. So we're waiting to see where September lies with most of our groups year to date, even through September. It looks like we're going to be below budget. Excellus has indicated that that August and September, they're looking to be at or slightly above budget. That's not what we're experiencing with most of our groups in Central New York, and doesn't look to be the case here either, but it's something we're keeping a close eye on, obviously. Budget versus actual over the years on the claims. And then just another highlight on the COVID-19 pandemic and what it did to the claims. Overall, over the history of the plan, we've been about 4.5% below budget in terms of what we've anticipated in terms of paid claims and where we actually ended up. A little bit of information on COVID-19. I'm not going to bore you with this, other than to show you this exhibit, which shows, you know, historically for 19, we're at about 2.37 million per month in terms of medical claims. First 3 months of this year, 2.4 million, and then in the last 5 months, just over 2 million. So again, just the mitigation there in terms of claims based on the COVID-19 pandemic. With that, I will stop there because we get into the budget discussion from this point forward, and I would ask Rick to share any thoughts that he might have from the treasurer's perspective in terms of our financial position at this point.
Good evening, everybody. I don't have a report to give you tonight. Other than that, we worked with Elin and Steve on putting together some of the plans for the potential holiday in December. That involves a few of my staff working to make this happen. If the board chooses to go forward with this December holiday, we've also been helping them with budget figures, and we've been doing a lot of extra work with some of the investments recently. And the sad news on our investment front, as you are aware, interest rates are at near zero. Last year at this time, we could look at interest rates for the year averaging about 1.5%. And we just invested another $4 million and we got 0.1%. So you see the big difference in interest rates that just 1 year can make, going from 1.5% down to 0.1%. So that will have a harmful effect on our investment income for next year if rates remain this low. On the last thing I wanted to report out on is that I'm willing and able to serve as your treasurer for one more year or longer. But the question came up as we were putting our very austere county budget together. Our department, as all departments in the county, was asked to cut our budget by 12%. And so we did some across the board sweeping cuts to come in at that measured level of reduction. But through that process, we were able to put in for special extenuating circumstance requests to bring our staffing level for 2021 back up to what the existing level is. And I think for the most part, our legislators are looking favorably at that, and we should be able to restore all our staffing needs back to the current level for next year. With that said, there was some discussion about whether the county's finance staff would continue to do the consortium's books. At one point, we said that after speaking with the county administrator, we might stop doing the consortium's books next year. I affirmed with Elin and most of the consortium members at the Audit and Finance Committee that we're certainly able and willing to go forward for another year and serve the consortium the best that we can. And that includes doing your audit, doing the investments, doing your books on a monthly basis, all the billing, all the accounts payable, and everything that we've been assigned to do for the consortium. We'll do that all through 2021. If there comes a time and place when positions are hired directly through the consortium to add staff and slowly take over some of these duties, we'll be glad to accommodate that and relinquish control on some of the tasks that we're involved with. But as I spoke with Elin, we know that that's going to take a period of time. It could take anywhere from 6 months to 2 years. So caused a lot of confusion as we put our budget together, and as I tried to explain to our legislators that we really need to keep our existing staff in place. And I wanted to let you, the board, know, as well as the executive committee and Elin, that we're committed to going forward with a consortium into 2021. And if we can start delegating duties out to other staff members as a consortium hires them, we'll be willing to train and work with them all through next year. So that's my report for tonight, and I'll take any questions that you might have.
Thank you, Rick.
Yeah, I have a question, Rick. First of all, I want to thank you for what you're doing. I know you're juggling a lot of tennis balls these days, and you know, I think we should all reach out to your department and thank you. And I'm going to do that on behalf of this board. Also, I'm sure you and Elin, or I hope you are, discussing exactly what the vision would be for this consortium's staffing to sort of start assuming some of the heavy lifting that you're doing right now, and we will appreciate all that.
We'll be doing that. We'll be speaking to that at both the Operations Committee level and at the Audit and Finance Committee level. And there probably won't be a month go by that you don't hear some level of detail on how we're progressing forward with regards to new staffing for the consortium.
Rick, I have a question. Is it possible or legal that your department actually bills the consortium for the work you do, so you can continue to do it?
We do bill the consortium for the work that we do. It's about $65,000 a year. The way that we come up with that contract each and every year, it's 70% of one of our account clerk, payroll clerk specialist positions. Jessica Hobart, who many of you are familiar with, is the consortium's billing clerk, and 70% of her position is billed to the consortium because that's the time that she spends on consortium work. About 10% of the deputy director, Drew Brayman's, time is billed to the consortium. That's for review of the jurats and for a lot of the accounting behind the scenes and attending meetings when I cannot. And that's the only thing that's built to the consortium is 10% of the deputy director's time, 70% of accounting clerk, payroll specialist time, plus fringes, of course. And that's how the consortium has been billed based on that simple formula since its inception.
So if there's already a system in place to pay the county,
yes,
why would it be a question of whether you want to farm out those services, because you'd lose that revenue as well?
Why would the county want to do this, or why would the consortium want to do that?
No, why would the county want, you're suggesting, I'm hearing, maybe I'm hearing it wrong, that in the future you may want to farm back out the position to somebody else other than the county. But if you get...
It would be, this is Elin answering that question. This is going to be an agenda item for the Operations Committee, and then it will be brought back to Audit and Finance and the board. But really, it's bringing we as the consortium have been outsourcing a lot of services. As you know, until last year, there was no staff in the consortium. The consortium is now growing at a level that some of the services will need to come in-house or be better served, possibly better served for the consortium by bringing those in-house rather than contracting a percent of somebody's time. So that's what we're looking at, and that's what the Operations Committee. So it's really bringing those responsibilities in-house, but continuing to use the expertise of the county in their coaching and consulting of those positions.
And I just finalized by saying that through the many years that I've been here, just 7 years, we've never billed a consortium for any of the director of finance's time. So they've never paid for any of my time. It's just part of the formula that we've come up with, which is very conservative and very inexpensive for the consortium. The question on whether and how fast the executive committee and the operations committee chooses to add employees to the consortium staff to slowly take over these duties is completely up to them. That's not something I or anybody on my staff has thought about or has suggested or taken up. That's simply something that comes from the consortium on whether and when they want to make this switch or this change.
Right. So I would just hope when we do that, all the factors are considered, fringe and everything, because it may be financially, I understand principally you may want to bring everything in-house, but it may be financially beneficial to keep it the way it is.
So I just want to comment that the executive committee will be talking about this more on our full staffing plan for next year and for years to come at our executive committee meeting. And we'll be bringing some more stuff back to operations and such. So I do want to get the meeting keep moving forward. Thank you, Rick, for your treasurer's report and all of the assistance that the county finance office has given us over the last 10, 11 years. So we really appreciate how much the county has dedicated to the consortium and making sure that it's running at an efficient level. So we really appreciate that. So
Sure do.
You're welcome.
So Steve, are you going to be addressing the proposed budget? And Elin?
Yeah, I was just gonna, Steve's gonna walk through the slides. I was just gonna give a little preamble to discuss kind of the direction that Steve is going to lay out in front of you. And a lot of this isn't a surprise because we discussed it in August. And as Steve went through the 2020 results, please keep in mind as we look at the premium holiday that our claims expense continue to be 11+% below plan. So our combined claims expense for Excelis and ProAct. As Steve noted, Excelis as an organization, a much larger organization than us, has seen their July and August claims and trending in September go up to a little bit more than normal. But in our world and in the Low C and Cahill world, that has not been the case. So those are some of the factors that are going into the presentation that Steve will be running through the slides that are in front of you. The other thing we discussed last month and Mac will be putting in front of us, Mac Cook, our chairman of Audit and Finance, will be putting a policy in place or a practice in place to help us to adopt budgets in previous years. We've discussed a lot about the fund balance at various board meetings and the percentage of fund balance. The goal in the past has been 18%. We're up at what, 28+% this year. The budget we're presenting, we will use a premium holiday to start getting that more in line. So the policy that will come before you is to really give us a guideline going forward. And certainly adhering to the policy as we transition our fund balance, we build our rate stabilization reserve and the coordination of all those things together. When we put together the budget, as always, the Low C and Cahill team under the guidance of Steve, we're looking at the claims trends, our claims trends, and those are noted in the report. We discuss with industry experts, Excelis and others, and we want to make sure we exhaust all those resources. And so the fine print, as you're looking through your budget. Michelle, did you say something? No?
No.
Okay. So if you, just look at the fine print of all of the work that goes into putting that budget together and why Steve is going to make the recommendations he is at this point.
Thanks, Elin. So I'm just going to walk you through fairly quickly here the budget makeup for not only 2021, but even looking out over the next several years where we think things will go. And obviously this year is substantially different than we thought it was going to be. And of course, COVID-19's thrown everybody's world into a little bit of an upheaval as a result of everything that's going on, from the quote unquote pause to people being out of work to, claims being down, et cetera. So all of those factors have kind of played into this budget. And on top of that, we're trying to obviously stay within our norms in terms of modeling for trending and things of that nature, and trying to modify things based on what we saw this year, and trying to look at what this year would have likely been had not been for the pandemic, and then going forward from there. So with that said, I'll just walk you through a little bit in terms of the budget, and certainly you can ask whatever questions you want as we go through this. But the first couple of slides in terms of the budget presentation, just providing some definition to all the different categories. And one of the things we try to do with this particular report is we want to make sure that you have a document that you can take back to your local municipalities and share with your boards or other concerned constituents so that they can have an understanding of what the consortium operation looks like from a financial perspective, and they can have a better understanding of exactly what is transpiring here. So some definition in terms of income, and then our income projections for the 2021 fiscal year, and hopefully everybody can see all the way to the end there. I don't know how to get the faces out of the way, but for this year to date, you'll see that we have highlighted the medical and RX plan premiums. We were only showing about $48.48 million. The reason we're showing that is because of the 1 month premium holiday. So we've factored in to our end results for this year based on August 31st. Actual results, we've trended them out to the end of the year, and we've already applied our year-end premium holiday to this number. We anticipated being around 52.75 million. The premium holiday accounts for about $4.4 million for this year. Other than that, you'll see our interest income is down from what we had originally projected for the year. Rebates about the same. And the end of the year number, obviously, again, is about $4.3 million less than it would have otherwise been because of the premium holiday. For next year, we factored in the 5% increase based off of what we should have accumulated this year in premium for the full 12 months. Obviously not looking at the 11-month total, but looking at our 12-month projected total. We also took a hard look at our interest income and decreased that expectation substantially from about $400,000 down to $45,000. So next year we anticipate ending the year with revenue of about $57.3 million with our 5% increase. And then going forward, we projected out 2022 through 2025, and the numbers that we're utilizing for those outlying years in terms of premium increase are 5% in 2022, 6% in 2023, and then 7% in both 2024 and 2025. Other than that, the only real major difference with the outlying years is that we did return the interest income to about a 1% factor, hoping that those interest rates will rebound a bit and using more of a historical number. So that's kind of the outlying look at income for the next several years from a budget perspective. Then in terms of assumptions and notes, I covered most of this stuff already through my discussion. Certainly read through all that at your leisure. Getting into the expense side of the budget, again, definitions in terms of the major expense categories, and then getting into the actual nitty gritty of the budget. So as you're looking at this, you'll see our projection again for the end of 2020. We're looking at a much reduced number in terms of medical and prescription drug claims than what we were originally anticipating. Originally, the year started off, we were looking at 51.5 million as the expectation. Right now, we're thinking we're going to be a little bit below 48 million once we get to the end of the year. So that's basically where we're generating the net income to help offset that premium holiday for this year. So when we get to the end of the expenses, we're looking at about that, $3.6 to $4 million range in terms of expectation of net income. And our budget is obviously down less than 51 million for end of the year. For next year, our claims trend was put on what we thought this year would have looked like had we not had the pandemic. So we're not trending off of the $48 million number. We're trending off something much higher than that. And as a result, next year's claims expectation is about $54.7 million. And again, that's a couple different factors in there. One, adjusting our claims to what we thought a normal year would have looked like, and then trending off of that. All the other expenses are trended based on our normal factors, admin fees, and other professional services at about 3%. Same thing with internal fees. So all of those are pretty static in terms of the trend going forward. The claims number is the one that really does oscillate a bit. And we really had to do some research and a lot of factoring this year because of the odd result that we've had through 2020 year to date. With that being said, in terms of looking forward, again, projecting our claims out over the next several years, we again gave our 5-year pro forma, including 2021, all the way out to 2025. And you can see even with the numbers of people that we have currently, and this doesn't include increases to the numbers, because when we were developing the budget, obviously we got to do it based on our known population. We can't speculate. We're doing it based off that. We'll factor the budget based on increases in population once we know what that will be. But even with that being said, our budget goes from about $58 million all the way up to $72 million by the time you get out to 2025. So just by increasing claims on normal trend, we're still seeing some pretty substantial increases in overall dollar amounts as we go through the years. And that's obviously what's weighing into those premium increases of 5%, 6%, and then 7 and 7% in the outlying years. Some notes, obviously, in terms of the expenses, one of the biggest thing is trending. We took a look at what trends are for the consortium as a whole. We took a look at our trending models for our collective book of business throughout Central New York. Relied a lot, obviously, on our own expertise in terms of massaging those numbers to some extent. But the percentages that we came up with for this year were a trend of 5% on our medical claims annually, and a trend of 7.5% on our pharmaceutical claims annually for not only 2021, but all the way through 2025. So that's the trending numbers that we were looking at. We did provide some graphs to show where we came up with those figures. First, the consortium's own data, both medical and prescription, and then our consortium-wide business that we have throughout Central New York, which includes over $500 million in premium or paid claims for the year. So that group is all included in here. And you can see we did highlight the pandemic here in terms of our trending, and that's one of the reasons why we made some adjustments off of the numbers that you see listed here for both medical. And then pharmaceutical, not so much. We don't see a lot of change in terms of pharmaceutical expenses because of the pandemic. So a little closer to the actual number on that, but with the 7.5% going forward. In terms of some other notes, again, just talking about the 3% increase on most of the other administrative fees, et cetera. In terms of our taxes and fees that we pay, we did trend those by 5%. Both our New York State Covered Lives Assessment, which is a tax paid to New York State, and then any of our Affordable Care Act fees, and specifically the PCORI fee or Patient-Centered Outcomes Research Institute fee. Again, those were all trended at 5%. Stop loss insurance, we did trend at 15% per year. As you know, we did modify the stop loss this year. We now have a program that includes a $1 million deductible, and we've kind of mitigated that exposure with increasing the catastrophic claims reserve and utilizing those funds for any claims that exceed $500,000 up to the $1 million deductible with specific stop loss insurance. And I can tell you so far year to date, we haven't had any claims go over that $500,000 mark as of yet. Obviously, we still have 4 months worth of claims data to accumulate, so we probably will have a couple claims that do exceed that number, or a couple claimants that exceed that number for this year. So we'll be able to mitigate that to some extent with the reserve fund. And then if anything does go over the $1 million, would get submitted to the specific stop loss. Other than that, all the other fees are pretty nominal. I did mention about the 3% on any external professional fees, and then 3% trending on any internal professional fees as well in terms of coordination fees. And specifically, speaking about the county financial support that they give, any internal fees with the consortium relative to the executive director and administrative support, et cetera. All of those were trended at 3% for the years 2021 through 2025. In terms of Liabilities and reserves, we talked a bit about this at the last meeting. The only true liability that the consortium has is what's referred to as incurred but not reported or incurred but not paid claims. And basically the easiest definition I can give you for that is we know that we have people that have received services today, yesterday, the last few weeks, whether it's inpatient hospital or physician visits or whatever it may be. It takes time for those claims to first be generated in a bill from the medical provider's office or the facility's office. And then that bill get to Excellus or PROACT for adjudication. And then ultimately the bill gets back to the consortium for payment. So there's a time lag built into all of that. And that's basically what that incurred but not reported or incurred but not paid claims is there for. It's to protect any claims that are incurred up to today that would be paid after today. So if you made a decision tonight as a board to disband the consortium, which you're not going to, but just as a hypothetical, we know that we would have to still pay claims because of those claims that are incurred but not yet received. So that money is really locked away. It's not something we can touch. The state sets the rate at which we have to fund that at 12% of expected incurred claims, which is conservative, but it makes sure that we have enough money in the bank to pay any claims that are incurred. That basically gives you the satisfaction or the freedom of mind to know that at any point in time, if the program were to end, we wouldn't be coming to you to ask for more money to pay for claims during the run-out period. So that's really what that's there for. In addition, we do have some other reserve categories above and beyond the incurred but not reported claims liability. We have a surplus account, which is a statutory reserve from the state level set at 5% of premium, expected premium for the year. We have the catastrophic claims reserve, which is a discretionary reserve established by the board at $4.5 million for this year, again, to fund those claims between $500,000 and $1 million in that exposure that's there. And then we also have a rate stabilization reserve, which again is a discretionary reserve set by the board. This year, it's currently at 7.5% of our expected premium revenue for the year for that particular reserve. And those are the reserve categories that we have. Anything that's left after that is considered unencumbered balance or net balance, if you will. And that's some of the funds that we're utilizing to cover not only the premium holiday for this year, but also to help mitigate rate as we go forward, looking to use just small bits of that over the next several years to keep the rates as low as possible. And we give some definition about each one of those reserve categories that you can certainly go through. And again, some of this is not new to you folks on the board, but if you were to pass this on to someone else, they would have a good understanding of why these reserves exist and what they're used for. We did provide for year-end 2019, where our numbers were at the $32 million mark for our total assets and how they were broken out. And then for this year, we're showing what our reserve funds were estimated to be for the year to date, and then what our actual results year to date are in terms of net income, et cetera. And you can see that certainly our net income is significantly higher than we thought it would be at over $4 million. We actually thought we were going to take a small loss this year. And as a result of that, our ending balance is quite a bit higher. And certainly our unencumbered fund balance is quite a bit higher than what we had projected for year end. In terms of recommendations, again, I think all of this stuff has pretty much been covered through the discussion. But for next year, we're talking about maintaining the surplus account as required by state law under Article 47 of the New York State Insurance Law, maintaining our IBNR reserve as set by the department, and again, in compliance with Article 47. And then also maintaining our statutory reserves at the $4.5 million mark for the catastrophic claims reserve. And I'm sorry, I misspoke. The claims and rate stabilization reserves, not 7.5% of premium, it's 7.5% of expected claims for the year. My fault on that. So it's 7.5% of expected claims for the year, or about $4 million for next year. And again, those are discretionary reserves established by the board, and certainly those are at your discretion to review and modify each year as we go through our processes. Continue to negotiate reasonable administrative fees with both Excellus and ProAct. Certainly look to squeeze out as much interest income as we can. And basically in consideration of all of that, we're just reminding the board that we're recommending a 5% increase. And for your information, a variance of 1% plus or minus off of that 5% is another slightly more than $500,000 in terms of increase or decrease to the overall budget on an income perspective for 2021. The last thought we had in terms of budget recommendation was relative to the premium holiday for this year. And again, the rationale behind that is we've basically been able to set aside a net income almost on par with what 1 month's worth of premium would be for this year. So to take advantage of the situation, the lower than expected claims cost, try to provide some immediate relief to all of the municipalities that participate in the consortium, provide that premium holiday for this year, and then also look to keep the rate increase modest for next year at that 5% level, which may require some modest use of fund balance again, but certainly not getting us down to the level where we're not within our philosophy in terms of budget setting. And that's something that the Audit and Finance Committee has been working hard on, trying to come up with a budget philosophy for the group moving forward to help guide, the principles as we go through future budgets, and probably, hopefully, making some of these decisions a little bit more form-fitting and a little bit easier to go through from year to year. In terms of annual rate increases over the years, just to give you an idea of where we've been, you can certainly see the history here. When we started the consortium, we had some pretty substantial increases. And believe it or not, during this time, those were the averages that both the county and the city of Ithaca had seen in prior years. And they were happy, believe it or not, that it gave some stability to the program, even though the numbers were a little bit higher than we would have liked to have seen them. After the 2014 fiscal year, we pretty much dropped right off. And for the last 5 years, we've averaged about 4.8%. So over the history of the consortium, the average rate increase has been 6%. For the last 5 years, it's been just under 5%. And even with our projections through 2025, we're still looking at about 6% overall for the consortium for the entire history and the projection going forward. And then for the 5-year average from 2021 to 2025, we're at about 5.8%. So pretty similar to what we've seen historically. We think we'll see similar trends over the next several fiscal years. And hopefully that gives some stability to the budgeting. I know it's going to be a very difficult year coming up in 2021. And certainly this year's not ending well either from a tax revenue perspective, and certainly with the state cutting a lot of the funding. So our push was to try to get some relief, both immediate and long-term, and stability. So those were kind of the guiding principles behind the development of the budget from our perspective. And with that, I would certainly open it up to any questions that folks may have. And I don't know if Elin, if you want to add anything else in terms of commentary, or Judy, from your perspectives in terms of the budget for 2021 and then the outlying years.
No, I don't have additional comments. I think it's, been vetted by Audit and Finance. We've discussed it at last board meeting, and now a much more comprehensive presentation that everyone's had a week to look at. So thank you, Steve.
Steve, I had just a comment on the last chart you had. The chart showed the 5-year average at 4.8%. But it's actually 5.8.
So yeah, the difference there is the last 5 years, including 2021. So from 2017 to 2021, that 5-year average is 4.8%. The 5.8% is from 2021 through 2025.
Okay,
so
thanks.
Got a couple of larger increases built in at the end there, and that's what bumped that up a little bit.
Thank you, sir.
Yep, no worries.
Any other questions for Steve? If not, we will move into audit and finance and actually address the budget and the premium holiday.
Mark here. Steve, can you explain again what I think I heard you say about what drives the premium increase primarily? Like
the primary factor in the premium increase is really the medical paid claims and prescription drug paid claims trend. So with our particular group here, 94% of your expenses is directly related to benefits being paid out. So in terms of what drives the budget, it really is our expectation on paid claims from one year to the next. Whatever that trend is going to be going forward, you can pretty much assure yourself that that's going to be pretty close to what the premium increases will be. Okay. So that's really the main catalyst behind what happens in terms of increasing costs from year to year. It's really solely related to benefit and what the cost of care is. And those two things obviously are intertwined in what we actually pay out as a plan, and whatever those trends are is what drives that premium increase.
Okay. Did I hear you say something about population too?
So yeah, whenever we're doing trending and modeling like this, we're using all the known facts that we have today. So one of the things you're going to be considering a little bit later on in the agenda here is adding another 8 municipalities to the overall numbers of the consortium. This budget has not been factored for those additional 8 municipalities. Typically what we do is once we get agreement that they're coming in and we know what plan they're coming in at, we'll go back and refactor the budget based on the increased covered lives just to make that transition. So we have a good expectation for 2021 what our real numbers will look like. It really doesn't change much in terms of our budgeting or forecasting, especially when you're talking about groups of this size. The groups coming in are very, very small. So we're not overly concerned that they're going to in any way, adjust our thought process for 2021. If we had a really large group coming in, like another county as an example, we probably would have factored that in prior to today in terms of impact, just to see what it would have been. But for these groups, they're relatively small in numbers, and it really doesn't impact what we're looking at for 2021.
Okay, thank you.
Yep.
I remember from our audit and finance, and anybody on that committee can chime in, but we had a lot of discussions about a lower percentage rate increase. And then we really had to study what we were looking at and what our costs were. And that's when looking at the trend that Steve has presented and making sure that we're covering that trend is our most important aspect. So that's Don really explained this pretty well, that we, at the 5%, we're still not at where our cost trend is. So that's why we're thinking that we would probably end up using a little bit of fund balance over the next year. So any other questions, or should we go to Mac? Okay, Mac, I'll turn it over to you for audit and finance report.
Okay, thank you, Judy. The Audit and Finance Committee has 5 resolutions to tender for your consideration tonight. What I'd like to do with each resolution is I will introduce it, and then to better keep track of the first and seconds, I'm going to ask Judy to handle that. I'll open it up for discussion, and then I'll ask Judy once again to call for a vote. As we mentioned in the change of agenda, we're going to take item 10B ahead of item 10A. So we'll talk about the premium holiday prior to talking about the next year's budget. So we will start out on page 79 of your agenda, where the resolution to adopt a premium holiday is tendered for your consideration. And so Judy, if you could ask for first and second and so track, and then I'll say a few words.
Okay, would somebody like to move this resolution?
Moved, Terry Baxter.
Thank you, Terry. Is there a second?
Seconded, Mark Whitmer.
Thank you, Mark.
Thank you. This has been a topic that the Audit and Finance Committee and the Executive Board has spent many, many months on. There's very, very little that I can add to the discussion that hasn't already been added, except I would like to stress, and it is in the resolution under the last resolve, is that this holiday, this premium relief extends to the employee, the employer, and the retirees. So the employer, the employee, and the retirees will benefit from this holiday. And with that, I'd like to open it up for any discussions or questions that the board may have that we have not already addressed.
I would just, so people are aware that your December coverage bill would typically come out to you by November 1st, and then payable to the consortium by the end of November for December coverage. So that is the bill that we are considering today.
Kevin Williams, Town of Homer, if I can cut in here. I remember last month I had expressed my concern about doing a short-term hit versus a long-term hit. And I ran it through my board and they seemed ambivalent about it. It's going to go in one calendar year or the next calendar year. I didn't get too much action on that. So then I started looking at what would be the best for the entire consortium. And I'm probably going to stick with that and say I'd prefer a runoff if we had anything after the fact, not before the fact. Meaning we can maybe tweak those 5-year projections down a few decimal points. So I would actually end up voting no on the short-term premium relief and looking to do something in the long term. The town of Homer, most towns usually have their money. We've already got it budgeted for this year. Would seem to me that I would look out for the long-term health of the group on this one. Then that's where the mop would flop for me.
Kevin, you're not the only person that has expressed that. It has been a robust discussion since March in both the executive board and the audit committee. The thought, the consensus was that if we reduce the premium instead of a holiday, it'll be very difficult for the consortium to maintain one of its prime overarching goals, which is rate stability. So we measured that goal against the sharing in the lower premium, lower cost this year, and we reached a consensus on the latter. But your thought is well, and it has been considered at length.
No doubt, I believe it has. And you have a city and I have a town, and our taxing ways are different for sure as far as that. But like I say, I also go back to the found money principle. I'd rather keep it for a while and then know where I'm going to be in a year and then distribute it in the following subsequent years, even if it was a lump sum. Mac, I don't know what's going to happen tomorrow, much less in 2 months, 3 months, or another year. So I know you guys have a lot of due diligence on that, and I'm really thrilled with the amount of work and quality of work that comes out of on the committee. No doubt this was a robust, as you said, point of discussion. No doubt.
Other questions? Thank you, Kevin.
Thank you, Kevin, for your input and your compliment to the committee.
Still vote no.
You're allowed to.
Understand that, Kevin, yes. And I'm glad that you have given it the thought that you have to reach that conclusion.
Mm-hmm.
Are there other questions, discussions, considerations that the board would like to bring up at this time? So Judy, if you could call for a vote.
Okay. So we will call for a vote for the adoption of the premium holiday for members for coverage for December 2020. All those in favor say aye.
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 Nays?
Nay.
No, on town of Truxton as well. Thank you.
And Tom?
Thank you.
Okay. Abstentions? Abstentions. Okay. So that passes. Thank you.
The next resolution is the adoption of the budget, the premium rates, and the reserve accounts. You'll find this resolution on page 78 of your agenda package. And so once again, Judy, if you could move this in and track the first and the seconds.
Okay, somebody would like to move the adoption of the 21 budget?
I will, Town of Homer, Kevin Williams.
Thank you, Kevin. Is there a second?
Chuck Rankin.
Thank you, Chuck.
Thank you both, Kevin and Chuck, for moving it. I'll say very little on this. It has been covered in quite detail and perhaps much more than I could do as far as the quality in the previous discussions. I simply do want to stress what the premium rates will be as a percentage. Many of us, I think all of us, are struggling with budgets that we're actually trying to look at how we round numbers up or round numbers down and how many digits we take it out to balance. So for those who will leave this meeting and do their budgets tonight with this information, these are the actual rates, the premium rate increases. They are not all 5%. And I will start with the metal plans first. The platinum plan will increase by 5.00%. The gold plan will increase by 3.82%. The silver plan by 4.06%, and the bronze plan by 3.96%. And all other plans I did not mention will increase by 5.00%. So I just want to make sure that the percentages that you use tonight to do your budget, you have it down to 2 digits. Are there any other comments, questions that we could answer on the 2021 proposed budget and rates?
I would also add that in the rates that you were sent, there were some plans that earlier this year, the board of directors had decided to either remove or restrict. So once they get posted on the web, those that were to be removed will be removed, and those restricted will say that they are restricted for new members. So, thank you, Mac. Any questions?
Hearing none, Judy, I would ask you to call this one for a vote.
Okay, thank you, Mac. So we'll call for a vote the adoption of the budget, our premium rates, and our reserve amounts for 2021. All those in favor say aye.
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 Aye. Any opposed or abstentions? Okay, thank you. That passes. I really want to thank our Audit and Finance Committee, Steve Losi, Don, Elin, everybody who's put in just a huge amount of work this year on the budget and the premium holidays. It has really been a lot of meetings and a lot of spreadsheets going back and forth. So I really appreciate all the effort that went into that for a good response. Thank you.
The next resolution, I always consider it an honor for the Audit and Finance Committee to bring it forward. And this revolves accepting the applications to our consortium of several villages and towns. And as your agenda says, and this resolution is on page 80, we tender for your consideration to accept the village of Owego, the towns of Barton, Catherine, Cuyler, Dix, and Hexter to become full members of the consortium, and that membership would be effective January 1st of 2021. Judy, once again, could you move this for me?
Okay, is there somebody who would like to move this resolution?
Move and make that motion.
Okay, I have Gary, will do you as the first, Eric as a second. Is that all right?
Oh, that's fine.
Okay.
Thank you. We are always asked what that would increase our contracts up to. And I believe the acceptance of these municipalities will increase our number of our contracts by 90.
Yeah, 83.
Okay. Any questions? Okay.
Judy, could you call for a vote?
Okay, all those in favor of acceptance, the applications by the Village of Owego, Town of Barton, Catherine, Kyler, Dix, Hector, and Tioga to become participants in the Greater Tompkins County Municipal Health Insurance Consortium, say aye.
Aye.
Abstentions? And nays. Okay, thank you. We're very happy to bring those municipalities upon.
The fourth resolution, which is on page 81 of your packet, is to accept into the consortium the Ithaca Downtown Business Improvement District to become a member. So I will ask for Judy, if you could call that or move that in, I appreciate it.
Okay. Anyone like to move this resolution?
I'll move it. Tom Brown.
Second?
Second, Mark Whitmer.
That's Steve?
I thought Mark Whitmer.
Just one point of discussion. Does that business district, can they do ad valorem taxing?
Yes, we'll address that here, Kevin, is that they are a qualified entity under the Article 47 because they do have taxing district. They do have taxing authority. Their tax, whatever, or any increase in their tax falls under the city of Ithaca's tax cap. And Steve Thayer is here tonight, but he has assured us that they are aware of that and that they will accommodate that. So yes, Kevin, they do have taxing authority.
And Kevin, the reason we are doing this as a separate resolution is because we have asked the Department of Financial Services to review this unique organization due to their how they are governed, and their articles of incorporation is a little bit different definition than we normally see for a municipality under Article 47. It has already been presented to the Department of Financial Services. They've asked for additional information. We are sending them feedback from our attorney, who has identified them, as Max said previously, as eligible. And so the reason we are separating this one is in case the Department of Financial Services determines that they would not be eligible under Article 47, that this would be a conditional approval to accept this with Department of Financial Services support.
Tom Brown here. I had listened in on the meeting discussing this, so I'm fairly comfortable with it, but I would wonder about their representation on the consortium, how that's handled.
They would have one vote, just like any other member.
So I have a question. So does this mean that it's the employees of the business district or all the businesses that are part of the business district?
The employees.
The employees, sir.
So there's only a couple of employees, right, of that?
Yeah, we are not extending it to the whatever members they may have or any businesses within that district. So it would be limited to the employees of the bid.
Uh-huh. Got it. Thank you.
Questions?
Any further questions that we could answer?
So Rich,
And
your other question, there's
Barbara
6
just mentioned
contracts.
that this would increase our contracts by six employees within the organization. Thank you, Don.
I'm cool with that. I just wanted to speak a little Latin tonight anyways.
No, Kevin, it's a very astute question. Thank you for it. Thank you, sincerely. Thank you very much. Any other questions, discussion? Judy, could you do the honor of calling us to a vote?
Okay, so we'll take a vote on the acceptance of the application by the Ithaca Downtown Business Improvement District to become a participant in the consortium. All those in favor say aye.
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 Abstentions? Okay, great, thank you.
The
I did, before we move on, I did want to acknowledge that Elvin White from the town of Hector is with us tonight. So welcome, Elvin. You know, we welcome you into the consortium.
Thank you, Elin, and Julie. I appreciate that.
Okay, the final resolution that we are bringing to the table tonight is a little housekeeping, and is to amend the investment management service contract that we have with our investment advisors, Wilmington Trust. And for those of us who follows the day-to-day operations of the consortium, we brought to your attention last month a like amendment, and I will ask Elin when it's after we move it to just discuss a little bit why we are amending the contract that we amended last month.
Okay.
So Judy, could you move this and track the first and seconds?
Somebody would like to move this resolution?
Move, Terry Baxter.
Okay, is there a second?
I'll second it, Ed Fairbrother.
I saw Steve Thayer's hand, so I will go with Steve's. Thank you, Steve.
Yep.
Elin, if you want to.
Yeah, thank you, Mac. The reason we are bringing this back in front of you is the resolution last month said there would be no changes in fee and no changes to the staff that was supporting us as we made this paper transition from one of Wilmington Trust's organizations to another. They then called me to have a discussion regarding rates. And the reason they want to change the rates, and it's a much different conversation than you usually have with investment advisors, is they feel that due to the climate, the interest climate, and our low returns as discussed in our 2021 budget projections, that they could not keep their fees at the same level. So their fees are being cut in half. So we're moving our basis points down 50%. On this contract. I thought you would want to support that, a reduction in fees, but since our previous resolution said no change in fees, we thought we should articulate that for the group.
Well, I don't know if I can stand for that. Just kidding.
Any discussion? Further questions that we could answer on this particular?
Yeah, I have a question. So 0.10 is about the going rate that a CD gets. You can get at a bank or many banks. So I don't know what value at 0.10 Wilmington is providing even at half the fee. I got they were great when we could play with 1.5 to 2, but at these levels, there's not much value added that an investment manager like that brings to the table at these low interest rates.
I would concur, but I would also mention that the process to retain an investment banker at all took over a year to put in place. A small but diligent group of people met almost monthly to bring this about. To forego that in this temporary rate reduction period that we're in, that may last a year, and then resume and go through that process again, in the long run, may not be in our best interest.
Yeah, I appreciate. How much is their fee even cut in half? What's the number?
From 10 to 5 basis points.
So they're taking half the return. If we get 10 and they get a half, we're getting a half. We're getting 5 basis points if they're getting 5 basis points. So, and I think what the Fed is on record. They're keeping interest rates at 0 for 3 years, not 1.
Yeah, I think that's right. I think
So
that's,
I appreciate, I mean, I think they did a great job, but given what, you know, is it worth giving up half our return, 5 basis points, to get 5 basis points? It's questionable. But I do appreciate the fact of all your negotiation. But I do think it's going to be longer from everything the Fed is saying. They're keeping rates where they are for a long time. So I just want to add that into the mix.
Okay, thank you, Rich. Peter, you wanted to address it?
yeah, I want to address that as well. I think we need to piggyback on Rich here. I think we probably would want to look at this pretty carefully in a year.
Okay.
Judy, it's Verden. I'll just jump in real quick. To Rich's point, I would just say that if we were with the trust company where we were previously, we would not be getting 5 basis points today. So even paying Wilmington 5 basis points and earning 5 basis points, we're doing better than we would get in a bank if we did away with that relationship. And I think the reason to Mac's point, the reason to stay with them is that last year, the best the trust company could offer us was 1%. Wilmington essentially returned us 2%. It's sad that we're in an environment where we're happy with 2%, but to Mac's point, to kind of hop on the train and hop off the train because interest rates happen to be low doesn't seem like it's going to be worth the effort it'll take in the long run.
I appreciate that, but I just want to clarify: the trust company is not the. I mean, where I work, I have a list of, let's say, 20 banks that give CD rates, and they're all at 0.10. So I wouldn't compare it to the trust company, but I do appreciate that it's a dilemma. I'm just bringing up. I just want everyone to understand what we're doing.
Any other comments?
So what are we getting from Wilmington Trust now? Let's put that out there again. I know we talked about it about an hour ago.
You mean services?
What's their rate, the rate of return on their instruments right now on the T-bills? I think it's T-bills, right? Laddered T-bills.
Yes, we currently have laddered T-bills. I don't know if Rick is still with us. He probably has a table in front of him.
Yeah, but in any case,
Yeah.
let's look at it.
I'm here, and basically they invest for us, like we just invested last week, $4 million to help bring our reserves up to the recommended level. They basically have a portfolio right now about $20 million of our money, and they invest in treasury bills, notes.
Yeah. Right, so you're projecting 0.10 because you're projecting 45,000 of it or less. So we're 0.05. I don't know. I get it. We're hoping that rates will go back up, but I'm just saying it's doubtful.
Okay, and Michelle also pointed out that this resolution is only addressing the current contract that we have with Wilmington, not our future contract.
Extending, yeah,
So this is
not
just
extending.
our current contract that we already have with them.
And when does that term end?
The January. Yeah.
Yeah, the beginning of the year.
So we'll have to vote on this again in January?
In December, their renewal will come up, same as Excelis and Proact and all of those. So. Any other comments at this time?
Judy, could you call this for a vote?
All those in favor of the amendment to Resolution 016 of 2020, approval of the amended investment management services contract with Wilmington Trust Investment Advisors Incorporated, say aye.
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 Nays?
Aye.
And abstentions. Okay, thank you. That does pass. Mac, anything else that you want to bring up from Audit and Finance?
No. Thank you very much for all your support to the board. Thank you.
Thank you.
Thanks, Mac.
So we will move on to Jim for the report on the Joint Committee on Plan Structure and Design and Own Your Own Health.
Hello. Yeah, so we met, let's see, earlier this month. No resolutions or anything like that to present tonight. We filled the first labor director vacancy to the board of directors. Welcome Nancy Webster. She's the Tompkins County Blue Collar Unit, CSEA 855. I'd like to thank her for her participation in the joint committee and moving forward with the board. Keep going with participation. I haven't reached out to many more members on the joint committee or bargaining members to try to kind of boost our numbers and kind of help quorum. We did clarify a couple labor representatives from the Village of Horseheads and updated our contact list. Thank you to Donna Dawson for this clarification. They have 2 bargaining reps, Steve Smith from the CSEA and Officer Sean Murray from the Police Benevolent Association. And I just, going forward with the, you know, our new governance structure and stuff, committees are going to be, you know, play a larger role in what we do. So I'd like to hopefully recommend and support our labor directors to participate on any subcommittees whenever they get a chance. And then as far as you know, Own Your Own Health has been kind of suspended and kind of rolled into the joint committee. So as Elin talked about earlier, we're beginning the flu clinic season. Clinics have been scheduled throughout October. Specific dates and locations are found on the website, and they seem to be changing pretty fluidly. So I would recommend that everybody goes to the website. I believe it's healthconsortium.net. Check under the employee retiree tab. Down at the bottom, you'll see wellness. Your slots must be scheduled online. No walk-ins are allowed due to the COVID. And you can also get your shots available through your primary care provider and some other pharmacies and stuff. I guess the point is let's just all make sure we get vaccinated and keep ourselves in good health. Moving forward with that theme, we did talk about the Maintain Don't Gain contest, which we did last year. It's sort of a challenge to anybody who wants to participate to kind of maintain their weight, if not maybe improve a little bit throughout the holidays. It's a program to promote nutrition and exercise throughout the holiday season. Because it is a time known for indulgent foods and maybe a little bit more relaxation and rest. So next joint committee meeting, which is actually going to be in November because we're kind of taking a break in October, nothing kind of big going on. We're going to be discussing the strategy for promotion and how this program is going to work. So that's pretty much everything we've been doing at the joint committee and with Own Your Own Health.
Okay. Thank you, Jimmy. Any questions for Jim? Okay, thank you. So like I said in the beginning, under new business, we do have an agenda item that we have to deal with, which is the 2021 MCA. So I will make a motion to approve the 2021 Municipal Cooperative Agreement and that is circulated to all participants for review and approval. Is there somebody who would like to second that?
I'll second it.
Thank you, Chuck. Any comments, questions?
Just one quick question. If we don't recirculate this MCA every year because we take in new members, what's the state going to do to us?
Annoy the heck out of me.
Okay.
Yeah, they don't send nice emails sometimes, so we're trying to keep them being nice emails. So thank you, Kevin. If there's no other questions, we'll call this motion for a vote. All those in favor, say aye.
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 Opposed? Abstentions. Okay, great. Thank you. So we have our 2020 and our 2021 municipal cooperative agreement. So thank you. So we will be back in December. December 17th is our last meeting of the year for our current board. We will be at that meeting addressing most of our contracts for the next year, stop loss, ProAct, Excelis, and so on and so forth. So everybody be safe and healthy. Enjoy some of the holidays coming up, and we'll see you back December 17th. Would somebody like to move adjournment?
Moved, Terry Baxter.
Thank you, Terry.
Thank you.
Okay, thank you very much.